let us talk about the medical consequences of the eating disorder. So someone has anorexia nervosa or someone has bulimia nervosa. What happens? What are the medical complications? The idea is when someone has an eating disorder, they usually has purging behaviors, and that leads to loss of fluid, electrolyte, and nutritional deficiency, significant nutritional deficiency. So loss of fluid, electrolytes, nutritional deficiency has consequences. Starting from the cardiovascular system, whenever we have vomiting or diarrhea due to the purging behaviors, oftentimes we develop electrolyte imbalance. And typical electrolyte imbalances are the hypokalemia, hypocalcemia, hypomagnesemia. So all of those electrolyte imbalances have cardiac consequences. Almost all of them increase the chance of arrhythmias. So starting with potassium, hypokalemia leads to a T wave inversion and ST depression. Hypocalcemia and hypomagnesemia causes prolongation of the QT interval. And QT prolongation usually leads to torsade de pointes. And if not treated, this can lead to cardiac arrest. So torsades de pointes is a type of polymorphic ventricular tachycardia. Hypokalemia, if severe, can also lead to a severe bradycardia and ventricular tachycardia. So that's about the heart. Next up is the hematologic system. As the patient have nutritional deficiency of iron, vitamin B12, folate, protein deficiency, there is decreased production of all cells, leading to a pancytopenia, meaning anemia, thrombocytopenia, and leukopenia. The effect on GI and hepatobiliary system includes an increased risk of having constipation because the bulk forming agents are not there, and often there is abnormal liver function test. In the endocrine system, due to the severe malnutrition, there is hypothalamic dysfunction, and that leads to dysfunction of the pituitary gland and the reproductive organs. So you have hypothalamic, pituitary, and gonadal axis, the HPG axis dysfunction. And whenever this axis doesn't work, this leads to hypogonadism. So hypogonadism, in case of a young male or a young woman, can lead to delayed puberty. So puberty will be delayed. Puberty will be late. In case of women, this can lead to amenorrhea. And whenever the puberty is delayed, there is usually growth retardation, and the patient does not achieve the maximum height. So the patient have a short stature. And sometimes the patient can develop a sick euthyroid syndrome. So those are the classic medical consequences of eating disorders. Starting from the heart, electrolyte abnormalities leading to arrhythmias, pancytopenia, constipation and abnormal liver function test, dysfunction of the hypothalamic pituitary gonadal axis leading to delayed puberty, amenorrhea, decreased growth, short stature, and sometimes a sick euthyroid syndrome.